After identification or staining of a bacteria, now we want to grow those pathogens, and for growth we use growth medias or medium. we, we use some uh, components or some growth media. We use some components in order to grow that particular bacteria or pathogen, and uh, the growth media has consists of two basic properties. The first one is selectivity or selective media. The selective media selectively favors one particular organism growth and inhibit the growth of the other bacteria, and for this we use a typical example of Thermatin agar. In this TMA we use vancomycin, we use trimethoprim, we use nystatin, and also we use colistin. Vancomycin for gram-positive bacteria, trimethoprim for gram-negative bacteria, nystatin for fungi, and colistin is also for negative bacteria. And they all try to inhibit the growth of positive, negative, and fungi, other organism except Neisseria family. And Neisseria is very much important as it is related for meningitis, and it is also related for gonorrhea. So one disease is very much fatal, like meningitis. Another one is gonorrhea. That is very much STI related. So the next property of a growth media is differentiation or indicator media. Indicator media or differential media, and it uses a change in color, and change in color happen when an organism uses some metabolism or does some metabolic activity, and it changes color. For example, the typical example of indicator or differential media is McConkey agar, and the McConkey is a lactose fermenting agar, in which the lactose fermenters, which are Citrobacter, E. coli, Enterobacter, Klebsiella, and Serratia, they all need lactose, and they use lactose to ferment lactose and change color to give pink colonies. After indicator differential, there is also enrichment media. For enrichment media, we actually give enrichment things like some chemicals, factor 5, which gives NAD positive, and factor 10, which gives hematin, in order to grow a particular bacteria or pathogen, especially the Haemophilus influenza, which can cause respiratory infection. Afterwards, we have enrichment media. We discuss enrichment, selective, then differential or indicator. Then we use there are some low yield agar or medias, in which there is a more or less less question arises. For fungi, we use Sabarod agar. and it grows all fungi. For charcoal, yeast extract, agar consisting of cysteine amino acid and iron, we can identify the Ella family, and this one is Bruce Ella, Francis Ella, then Pasteur Ella, and then Legionella. After this, we have eosin methylene blue blue EMB, and it give a green metallic sheen, and it is a differential or a selective for both kind of agar, and it is used for E. coli. Then we have Eton agar, and Eton uses cholesterol of Mycoplasma pneumoniae. Then some low yield low yield agar are for pertussis. In order to identify pertussis, we use Borget Gangu agar, and also which is a potato extract, and Regan Law agar, in which we use charcoal, blood, and antibiotics. And for seed for diphtheria, we use a pretty much important tellurite agar or Loeffler's agar, and it gives black colonies. Then we have Mycobacterium family, Mycobacterium tuberculosis, and we use Lowenstein Jensen media. We have some broth media, rapid automated broth cultures, and Middlebrook agars or medium, and these are very much low yield. The high yield, the question may often arises from these 2 or 3 medias.